I am so pleased. I am so pleased that you are here. Thank you both for making this journey to be with us. We're very honored. I'm really pleased to introduce Dr. Budzyńska, and she is going to speak to us about the effectiveness of succession planning. So we've been talking about leadership. We've been talking about who goes next. This is going to be a fabulous presentation. Please help me welcome Dr. Budzyńska.
Thank you. Um, um, it's, um, it's a great pleasure to be here today. And thanks to Anna, the co-author of this presentation, and my director of nursing. We are here today with you. And yeah, just believe me, like we spent almost 24 hours traveling to be here. And guess what? It was worth it because you are our inspiration, yeah. And we've learned a lot. This is third day of this conference, and yeah, we are for 100% of sure that we learn a lot. And we are here because it's like our possibilities, and we want to like show a presentation about succession planning, and it's because for our possibilities and our experience. And just believe me, like it's not common that Polish nurses come to America. Like, you know what I mean? It's like, and we want to show that Polish nurses can do it. And it was hard work to come here because book a ticket, visa and stuff, traveling, documents, presentation, language is very hard to do it uh, because people want to sit here and just look it. But nobody wants to be here and present presentation and stuff. Yeah, so it's much easier to sit and listen, but it's hard to speak to you. Yeah, you know what I mean. So yeah, and we want to show Polish nurses that we can do it, and we want to break the walls, you know. And I know that people in our hospital will gossiping about us. You know what I mean? Like, oh, like a star from America, and but yeah, this people wants to like they imagine like, oh, they go and they come back, but it's hard work to come here and have that kind of opportunity. So I'm very thankful to Anna. But back to the topic, I'm honored to present of the topic of the effectiveness of succession planning, insights from personal experience. We represent our hospital, Greater Poland Cancer Center, is in Poznań, Poland. Poznań is not capital of Poland, it's a Warsaw, but it's still a big city. Okay. The agenda. In this presentation, I will talk to you about the importance of succession planning. I will also introduce you how it looks like in Poland. So the average age of registered nurse in Poland, nursing education in Poland, nursing care paths, what we have for nurses, like what nursing paths, our strategies for succession planning summary, and I will invite you to Poland and question and answer. The importance of succession planning. So first, developing a talent pipeline. What's that mean for us? We cooperate with universities. So we have nursing students, and these nursing students have professional internships in the various oncology departments in our hospital. So it's we have many benefits from this because in the future we can like recruit these future employees to our hospital, and it's very good that the nurse can work in our hospital, and also she works in the university, so we can find a talent, and and recruit future employees. The next one is identifying potential future nurse leaders. Third is equipping chosen nurses with the leadership skills to transition into nurse manager roles. So these two is the most important for the leaders of our department. And the last one is prepares for retirement waves. It's like for us, retirement, it's not retirement waves, it's like a retirement tsunami. Like just believe me. And next slide, I will show you why. And succession planning, if we like imagine what is a planning, it's not the same like succession planning in the family business, because family business succession planning is graduate step by step. Yeah, it's a gradual transfer of leadership. But if think about like Polish succession planning, it should be very quick because we don't have time. And why we don't have time, I will show you on this slide. The average age of a registered nurse in Poland. Sorry. So you can see the forecast of the average age 2025, 55.2 years old, and in 2030 it's 57.7 years old compared to US, because I found US source data USA registered nurse in 2025 are 43.3 years old. So it's like very it's very big differences. Yeah, so just imagine that like the woman and in Poland retire at 60. So, and like most of this woman go to retire, so we will have like very big problem. Now we have problems. So, but in the future we will have like very big problem, and these figures shows that challenge is ahead of us. We need to figure out quickly which path to choose and implement in our operational strategies. So once again, we don't have time to like for succession planning, like in family business. It should be very quick. And I would like to say something about nursing education, because you can imagine our possibilities and our situation. So this is our education. So bachelor degree in nursing, 3 years, master degree, nursing specialization in postgraduate studies. Also, we have options to go like me and to get PhD, but the difference is like professional waves. So bachelor degree and master degree, students have classes and professional internships in various departments in hospital. And if you get a bachelor degree and you get a license for nurses after bachelor degree, you are a registered nurse. So it's only 3 years and you are registered nurse. So you can work as a nurse in a hospital, public, private, or it's up to you. And master degree, it's like something that you can do it, but you don't have to. This is for you. And bachelor degree, master degree, it's public, so you don't have to pay for these studies. And the third one, nursing specialization. So we can specialize in pediatric, geriatry, and surgery, and every specialize in. Also, sometimes we have money from Europe Union, and it's also for free. And the last one, postgraduate studies. It's like we pay for this. Sometimes also we have money from Europe Union, so you can do it this with 4 steps for free. But it depends on you. What do you want to do? And for example, postgraduate studies is like management in healthcare, and these three steps, bachelor degree, master degree in nursing specialization is if nurse can get it, the nurse have the highest salary in Poland. So no matter where you live, Warsaw, the capital city, or small village, it depends on your education. It's not very good because the cost of lives in Warsaw are more higher than, for example, in the small village. Yeah, you know what I mean. But it depends on you from your education. Yeah, and why I show you this slide, because in these steps to do the third one, nobody teach us management, leadership. Like it's just a little bit. On the master degree we have like two classes about that, but it's only like just a little bit. We can I've learned more here than in my whole education. Yeah, and the fourth one is postgraduate studies, and this is sometimes often it's not for free. So people don't want to go and do this because the government don't want to pay for this. Because if you, I told you, if you get this free bachelor degree, master degree nursing, is the highest salary. So it's no point to go and to be educated. Like it's like problem with mental, with people with mental, yeah. And also postgraduate studies, nurses choose it because they are already leaders, so they want to do this. But before, nobody teach us how to be a leader, about leadership, about management, about the transforming. So this conference is very important to us because we focus to, how to say, like, produce nurse, because we have lack of nurses, and be specialized in, but nobody like tell us how to well, how it's very important to manage people, like to be a leader. So that's why we have like a very big hole in this education. Also, I want to tell you that, like, bachelor degree, master degree, this is only on the universities. We don't have schools of nursing. We had before, but everything is on the university. So you have like a bachelor paper, like a bachelor paper, master paper. You have to read it, also write it, and also you have the final exam. So everything is on the university. You have documents, certificate. Nursing career paths. So we have two paths: is a vertical growth and horizontal growth. The first one, vertical growth, is it's very common in every hospitals. So we start from ward nurse, deputy head nurse. Deputy chief nurse is the same like deputy director of nursing, and chief nurse the same like the director of nursing. That's it. We don't have any levels up, or so. I'm here on this place, deputy head nurse, and Anna, she is chief nurse. And because it's this vertical growth you can see in every hospitals, but for us is the most important to start from the beginning. So I also be a ward nurse, and now I'm deputy head nurse, and I'm going up, up, and up. Why is this important? We don't want to jump from the ward nurse, ward nurse to, for example, head nurse. Why? Because we want to be prepared for another level of our vertical growth. Okay. Nursing career path, horizontal growth, because vertical growth is most common in every hospital. So we also, this is our horizontal growth from my hospital. because I showed you that we have like very short, um, how to say, level, like short vertical growth. So we have also horizontal growth. For example, first is hospital team for radiation inductor reactions, because we are oncology hospital. So we have radiotherapy, and we focused on the treatment and how to take care of the patient. So we build a group of nurses for that kind of radiation and inducted reactions. Next is pain control. Next is prevention and treatment of bed sores and vascular access. We insert now midlines. We started, yeah. So we started from midlines, and next plans is to insert peaks and probably ports, CVCs. We will see what's in the future. And but you can see that this horizontal growth, it's very good for young people that for example, they are on the they work in the ward, and also can have like horizontal growth to be like hospital team for vascular access and pain control. Second is writing hospital policies and procedures, organizing scientific conference. We organize that kind of conference, more oncology conferences, active participation, the conference, poster, presentation, speaker, and US visitation. So we are here. And to supervise and educate nursing students during their clinical placement on the ward. What about our strategies for succession planning? We have three. First is traditional nurse manager selection. And the second one is combination of scientific experience with clinical practice. And third one is a young leader with leadership potential. First one is pretty similar like a vertical growth, but this traditional nurse manager selection. So we also start from the beginning is ward nurse, deputy head nurse, and head nurse. Why is not the chief nurse? Because chief nurse and deputy of chief nurse is only two-person. So it's not very easy to be in this position. It's much easier to be deputy head nurse and head nurse in every department. Yeah. So this is like kind of vertical growth, but in a very short way. This process, this strategy is very popular and practiced in my hospital, but sometimes it's difficult for nurses who starts from the beginning in the same place. Why? Because today I'm your colleague, and tomorrow I am your leader, and I have to require from you. So it's not very easy. Sometimes we do it like you are in the ward, you are ward nurse in one department, and you go up and be deputy head nurse in different department, and you change the group of people with you work with. And yes, so why is very difficult? Because we don't understand the manager role, and because we have lack of management and leadership in our education. So it's very difficult to require from somebody to be a good leader or manager in the hospital. The second one is combination of scientific experience with clinical practice. It's about story of my life, because I am this combination. What about my background? I was a ward nurse. I've worked as a burn nurse. So I have clinical practice. I got PhD, so I have a scientific experience. I also have been a university teacher, so I have these three. And now I am deputy of head nurse, and I have supervisor my head nurse, and she teaches me how to be a good leader, how to be a good like manager in my department. But but on my level that I'm deputy of head nurse, I'm with I have like 50% of with patient and 50% be leader. It's not only like be a leader. It's like practice with the patient and also require from somebody. And my supervisor now, she's 25 years older than me, but she's like very good mental, you know. And you know what I mean? Like we have connection, and we have very good connection. And she teaches me how to be a good leader, and she prepares me for the next my vertical growth, how to be a head nurse. Also, I'm doing horizontal growth. I am in the hospital team for radiation inductive reactions. I'm here. I formulating strategic recommendation. So I do both, like vertical growth and horizontal growth. And for me, for young nurse, is very important that I can do like vertical growth and horizontal growth. And the last one strategy is about young leader with leadership potential. So you don't have to be the best with every task. You need to know how to manage the best professionals. And this strategy is not very common because I told you we don't understand that we need managers. It's not because of your age. It depends on yours, because despite of having limited work experience, a young leader may show natural management attitude like strategic thinking, responsibility, adaptability, and initiative. And the leader needs motivated colleagues, actively listen, and stuff. So if we have young nurse with this potential, why she cannot be a leader? Yeah, and but we don't understand. We don't understand because we have like also old generation, and they don't understand why she's like younger than me for 30 years, and why can require something from me. Yeah, so that's why this strategy is not very common, but we really try to do go further and change it. So, and it's also important that we have public healthcare. It's not the same like US. Like hospitals are not a business. So we don't need like manager. You know what I mean? Like people think that we don't need a manager, and especially due to generational differences and lack of understanding of the manager needs. The summary. First, succession planning is a key element of the healthcare in Poland, particularly in the context of nursing. Second one, because we have difficult system and we don't have education and manager education, we have to decide it like hospitals what we can do for nurses. And third one is creating opportunities. So vertical growth and horizontal growth is very important for young nurses, and management provides really opportunities for growth. And the last one, combining youthful enthusiasm and technology with the experience and wisdom of the older generation, serves as a guarantee of effective transformation. So I will invite you to Poland. Poland is here because Many people ask me, where's Poland? So Poland is here. We have many neighbors. We have also neighbors, Ukraine. And just believe me, we are very safety now. We will see what happens, but we don't have war in my country. It's only on the Ukraine, but still they are our neighbors. So we will see what happen in the future, but we feel very safe. The next one is beautiful places. We have Krakow, we have many places to see. We have mountains, we have lakes, we have seasides, and beautiful places. And it's very, very safety. And so what is famous from? We famous from dumplings. And so everybody knows Robert Lewandowski. He is a good footballer and he now plays in Barcelona. And thank you so much.
Do you have to wait a long time for somebody to move out of the role, like the head nurse role, for you to move in to it?
Anna decided to in this year goes like I'm going this year to had to be a head nurse in this year. So we will see what time in the months in this year. But yeah, I'm deputy head nurse 1 year and 4 months. So next step it will be head nurse, but she decided to move me to head nurse to be a head nurse in this year.
Well, does somebody have to, yeah, where's that person that you're replacing? Where does she go?
So yeah, I probably go to another placement, like another department. Yeah.
Where there's a, yeah, okay.
It's not a question, it's a comment. I have done my BSN program not in United States, and I have practiced outside of United States. So coming in, there are so many things that globally nursing can learn from each other. Globally, there are so many our problems and issues are same across the board. But if we get out of our silo in the world and interact with the global nursing community, there's so much that we can do to address all of our issues. Just things like education, because we had a 4-year BSN program, and in that program, 3 months was management. I had to work with a manager on a unit and run that unit. So I was doing staffing, I was doing everything for that unit in and out. Um, and this is when I was so when coming out of nursing school looked very different from what a new graduate comes out of school here. And it was very hard when I transitioned here. I think this was the most difficult transition to practice I had. I was an experienced nurse, but transitioning to a nurse at the bedside in the United States was a difficult transition for me because I couldn't understand why we had such a big gap, and what are we teaching our nursing students. So there's a lot we can learn, and I really appreciate you bringing this here. We need to have more conversation, we need to have more of these discussions across the globe with other countries, with other nursing organizations, so that we can broaden and we can stand as nursing as a profession as a whole. So thank you very much. I really appreciate this.
Thank you for your comments. Thank you.
I just wanted to thank you for your presentation.
Thank
And
you.
as I was listening to you talk, I just realized sometimes it's a difference of language
Yes.
because we used to call managers head nurses. And a deputy head nurse here is now in some organizations an assistant manager, in some organizations a clinical coordinator. It's just a difference of language. And your um, uh, vertical growth options, we call them champions. of certain teams, or we have other processes like clinical ladder. And so if there's anything that I could share with you, I would be happy to send you an article or information and try to figure out what it is that it equals to for whatever that language is.
Thank you. I will do it.
Thanks.